I get a lot of questions from patients. Is it safe to resect a portion of the submandibular gland? The answer is yes. First of all, you need to share with the patient what it is that you're seeing on their anatomy. Many times I'll examine them by putting my fingers like there, and if you can feel these big bulges sticking down, those are the descendant portions of your submandibular glands. We have 6 glands in our face that provide saliva into our mouth. They're parotid, the sublingual, and the submandibular gland. The neck is the primary area that they're looking to achieve. Sure, we can do the face at the same time, but many times the neck is what our eyes are drawn to and really connote that sign of youthfulness and energy. If we're going to operate on the patient, we've got to get their neck right. This is a huge controversy. I have many great surgeon friends who feel very adamant about not addressing the gland. They have their reasons. Sometimes it's because they feel they don't need to touch the gland to achieve their great results. Good for them, I think that's great. Other times it's because they feel that it represents a higher level of intervention. And in doing so, there are a lot of blood vessels around there. And this is no joke. This is something that requires tremendous skill and expertise. So if you're a patient looking for a surgeon to address the neck and achieve these highly sculpted results, look for somebody who's been doing this for years and years, if not decades, because these are the individuals who are going to have the expertise and the comfort level to address those concerns. Finally, we talk about the incisions. At a minimum, you're going to need to make an incision up underneath the chin. It's a very, very well tolerated incision. It's almost invisible, allows access down into this area where we lift up the platysma muscle and we go down, and there we're looking at the submandibular gland. And that's where it's so easy to remove the portion that's hanging down because you're literally just looking right at it. My particular technique, I use the DeBakey as a cautery device. And so with one hand, I'm lifting up the gland, and the other DeBakey, I'm marching my way down, cauterizing as I come across it. There are other different ways of doing it, and I think that that's fine. I happen to believe that the safest way to do this in my hands is with the DeBakey acting as a bipolar cautery. It is highly specialized and curated to each particular patient. I'll see differences from one side to the other. One gland can be much more descendant than the other. So it's not cookie cutter by any means. Going to a higher level, what I have been doing is creating a neo-ligament, and that's a suture that I put between the hyoid bone. And so if you're not sure what the hyoid bone is, it's way up here in your neck, and when you swallow, you can feel it. And it's sort of a C-shaped bone that sits like this, and there are muscles that attach to it. The anterior digastric this direction, and then the posterior digastric muscle that direction. And so what I do is I lift up the platysma muscle, and I come through the platysma with a suture directly over top of the submandibular gland. Bones have very tough ligamentous structures attached to it. It's called a periosteum. You can put a suture through there, and it's very, very durable. Then you bring the suture back, and again, under direct visualization, it passes directly over the submandibular gland, and then pass it through the platysma muscle again. And so now it's passed out this way. Then we perform the platysmaplasty, which is a corset platysmaplasty, where we bring the platysma together, and that's what creates that great cervical mental angle. Now I've got this suture out here. So I take the edge of that platysma muscle and I lift it up, and that again gives a really, really strong angle, cervical mental angle. Then I take that suture that's going into the hyoid periosteum, and then that further gets anchored into the mastoid crevasse. And in doing so, I create a really strong cervical mental angle, and I'm tucking that gland up inside, and I'm caging it in there in that new position, so that you've got a beautiful jawline. So in recap, submandibular gland, it has a function. Its function is to make saliva for the mouth. So if there's a patient who comes to you and they're de novo say, I have a really dry mouth, you may want to talk to them and say, well, maybe we may not be able to achieve the high level sculpted jawline that we can achieve with partial resection of the gland, because in your particular case, we may need to keep it there. However, if people have normal salivation, then it's perfectly reasonable because you're not taking the whole gland out, you're just taking a little portion of it out. And then the next portion of this is to use that hyoid to mastoid neoligament. It's a phenomenal concept that I've been doing for over 3 years. What we're talking about here today is that gorgeous neck and jawline, and how do you achieve it? In my hands, I think you've got to at least think about what you're going to do to the submandibular gland and address it. Hope you found this helpful.